the Director of Nursing in KFMC, King Fahd Medical City in Riyadh. Also working with the Safe Birth Initiative in C2, Riyadh. Welcome all.
حياك الله دكتورة فهيمة.
وسهلا فيكم جميعا.
دكتور ناشي.
Good afternoon, everybody.
Yes.
I'm Dr. Nasher Rashidi. I'm the Director of Nursing Administration for Hail Cluster. I have PhD in nursing since 2015. Welcome all of you.
حياك الله. طيب ابتهال.
السلام عليكم. ابتهال إبراهيم، إدارة تمريض منطقة المدينة.
W4 مدينة. Thank you ابتهال.
Okay.
طيب دكتورة إلهام, she's يعني already introduced herself I think in the chat. دكتورة إلهام from Makkah Health Care, Chief Nursing Officer. And Rihab, Amaisa.
They're all from W1 Nursing Healthcare Cluster, Nursing Directors.
Yes, welcome. حياك الله. Dr. Jessica, are you with us?
I am.
Yes.
I am. Good morning. It's a pleasure to join you all. I'm worked in E1 for 5 years and left as acting director for chief nurse of E1.
Welcome with us, Dr. Jessica.
Thank you.
Ghadir. وإيمان عمر.
السلام عليكم. معكم إيمان بادوخن, Director of Nursing Administration in جدة. رحب بكم جميعا.
حياك الله دكتور إيمان.
السلام عليكم.
حياك. وعليكم السلام.
معكم دكتورة غدير, التجمع الصحي بمنطقة القصيم, الBMO بنماذج الرعاية. يعطيكم العافية جميعا.
حياكم الله. حمد الجراد from Najran, already I think he introduced himself. حمد معنا أنت؟ طيب شريفة.
أسعد الله أوقاتكم جميعا. شريفة العماري, Director of Professional Development في الإدارة التنفيذية للتمريض بالتجمع الصحي بمكة.
Can you please يعني talk in English so Sirner and Dr. Jessica will be able to understand?
Okay, I apologize for that. My name is Sharifa Lamairi. I am the Professional Development Director at Executive Nursing Office in Makkah Healthcare Cluster.
Thank you. Thank you. سعد الشمري.
السلام عليكم ورحمة الله وبركاته. سعد الشمري, رجال نيرسينج دايركتور من حق الباطن. حياكم الله وسعيد بتواجدي معكم. يعطيكم العافية.
دكتورة سماح فهمي. دكتورة سماح, she is the model of care leads in مكة المكرمة W1. I think دكتورة سماح, you have a problem in your mic if I'm not mistaken. So طيبة وأنت سمية.
Yes, السلام عليكم. Nursing administration.
Okay, thank you. Thank you. سمية. Hind.
Hello, good afternoon, everyone. I'm glad to join you. I am Hind Al-Kulayb, Regional Nursing Director in Northern Region, Arar. Thank you.
Thank you very much. I hope that I didn't miss anyone. Please make sure that you put your region or cluster in front of your name, please. And so let's starting our Connect sessions. Thank you, everybody. So as you're aware about the purpose of this Connect sessions is to provide an update, sharing lessons learned from different clusters and regions about the model of care implementation and the nursing participation in the model of care, as well as communicate about the transformation and how transformation with all the nursing leaderships. So for this meeting, inshallah, with these 2 hours, we're gonna have 3 items of agenda. The first one, which will be the nursing participation in the chronic pathway. This is Jeddah experience, will be presented by Mrs. Basma Al-Aswani. And the second one will be CNO. He will present the changing nature of healthcare in NHS and KSA, similarities and differences, and the contributions of nursing leadership. And the last presentation will be from Makkah experience about engaging the nurses in model of care initiatives. It will be presented by Dr. Alham. So let's start for the first agenda. The mic is yours, Atir. Take out. Thank you.
Thank you, Haya. We will start We will start our Connect session by showing you a video of 2 amazing women working as health coaches in our PHCs. Rug Mubarak, the health coach in Al Ashrafia PHC in Qasim, and Munira Al Qahtani, health coach in Al Yarmouk PHC in Riyadh 2nd Health Cluster.
Atir, we don't have, we couldn't hear the video.
There is no voice.
Yes.
There is no voice.
We could not hear that.
Yes, it still is not working. I think there is the problem with the mic with the you, Athir, for this video. Nora, what do you think? If can we share these videos in the chatting, the link for people they can see it and during the meeting or after the meeting? If this voice is not working.
Yes, of course. We will share it with you on the chat.
Thank you.
Okay, we will start with Ms. Basma, Jeddah Region Nursing Administration. Ms. Basma.
Yes, thank you, Mrs. Athir. So allow me to introduce myself again. My name is Basma Aswani, and I'm working at Nursing Improvement Unit at Regional Nursing Administration Jeddah. And I was a member of the project of the care coordinator, which is an element or a core element for the chronic pathway. So let me start by saying the history regarding the our establishment of the idea of the whole project. So we received an invitation from the National Transformation Office, Jeddah region, and that was on 2019. So that time the invitation was on a behalf of the Western Hub to attend the workshop. That workshop meant to brainstorm, and it was actually a 2 sessions workshop. So it meant to brainstorm and assess the current chronic pathway practices and highlight on the gap on that time, which is especially in the chronic care pathway. So since the case coordination is a core element in the chronic care, from the gap assessment, could we please go to the next slide? So we find that from the gap assessment, next please, we find that we need to work on a job description for the care coordinator role, and we had a limited pool for the people who are capable to work as a coordination, and also the current case for the coordinators are part-time with a high workload because they were giving the assignment for the nurses who are not free for that job assignment, and there were a high turnover rate for the existing trained care coordinators. So they were leaving that job assignment. And of course, they were lacking the specific training programs. So from that point, we found that care coordinator appointment needs to be established on a base and a strong base in Jeddah. So could we also just go to the next for the animation just to get the full picture? So from that point, we sat as a team, and we worked on the plan. So we set the plan, and unfortunately, that plan faced the COVID-19 pandemic. So we had to make amendments or edit on that plan. So the plan had to be elongated from 6 months to 8 months. So we started to work on the building a care coordinator from scratch as an assignment or an appointment. We set the task, and we were trying to assure that task will cover all the need for the care coordinator, which is to maintain or to provide an accessibility for the health services, to prevent all the health risk which the patient might face, improve the quality and efficiency of the health services, and upgrading the quality of services provided. So next, please. So here are the team of the project. The member were assigned or allocated from different departments. So transformational unit or transformational office at Jeddah region were member at that project, and also from nursing administration we had members. So the whole project took around 8 months, and the only problem that we faced during that project was the delaying due to the COVID pandemic. Next, please. So our main achievements during this project specifically, which is part of the chronic care pathway, was the documents and preparation. So we worked on the job description, and we established all the policies and related policies and procedures. And of course, we announced to recruit health practitioners, because deeply we were thinking that care coordinators shouldn't be eliminated for nurses only. We thought if the candidates were having a minimum criteria, which was set later by the committee or by the project members, so they can work as a care coordinator. Then also we assess the readiness of the PhDs and of the personnel itself, if they were meeting the criteria, and the PhDs also if they were having the minimum criteria to start with them as piloting. And we did 20+ interviews during that time. We did also a site visit for the places or the PHCs which were nominated to conduct the care coordinator. And finally, we worked on the program. The program was run over a 5 days program. There were 2 role plays and workshops included in the program. And candidates were also assessed pre and post to evaluate their outcomes. And recently, the whole achievements handled to the Jeddah Transformation Office to continue the supervision and monitoring for the PHCs, which already launched the model and started the chronic care pathway, which were nominated in the beginning as 10, but due to the shortage and the number of the candidates at that time, I believe they started with the 3 as the beginning. Next, please. So here are the criteria which we shared or agreed with the members. We find that the healthcare practitioner should hold a diploma as minimum degree in a healthcare specialist or a health care administration, and they have a valid Saudi council, and they supposed to be also good in a verbal and written communication and the computer skills as well, and their ability to handle multiple tasks and English proficiency, of course, minimum experience of 1 year at Jeddah Health Organization, and the applicants should be working within the Jeddah Health Affair Organization. Next, please. And these are the documents that we worked on, the job description and the checklist which we used or applied to choose the PHCs. Next, please. And here's the program that we run during that period with the topics which we tried as much as we can to cover all the needs to graduate a prepared personnel or care coordinator who are capable to cover all the needs of the patient and cover that position. Next, please. And this is the first PHCs that we launched the program in. And this is the picture for the whole team. And finally, regarding the recommendation, of course, beside the recommendations or the lesson learned from that project, the main recommendation which I might highlight from this experience is the early consideration of nursing participation within transformation plans that would really evolve the process of the transformation. Thank you so much.
Thank you, Basma. Do you have any questions for Ms. Basma?
Would you like to reflect? I know, first of all, thank you, Ms. Basma, for this presentation. And it gives a great brief about the work that has been done in a few years. I don't know, Jessica, if you want to reflect on some of what Ms. Basma has shared based on the experience you've had as well. And then I'm curious, I have a question as well after for Ms. Basma around the sustainability of the program. So how was the governance around the care coordination? So Jessica, if you want to go, you can hear from Ms. Basma.
Well, like you said, Noura, it's great to see the progress in Jeddah. I think they did a fabulous job trying to not only recruit, but train the nurses and have them prepared. I agree with the recommendation that nursing has to be part of the journey early so they can decide where the gaps are and what necessary training and reinforcement they have to do for their patients. So having said that, I think we were focusing more on just hiring the nurses and training them, which is fabulous. But what I was hoping to hear a little more was about the pathway and the challenges that they were faced with, and also the readiness of the clinic. So maybe that's for another session, but that would shed a little more on the question that you said. For the sustainability, it would be nice to know if it was embedded and what shape it took once the pathways were rolled out. But all in all, I'm quite impressed with how they selected the nurses and trained them. Thank you.
Great. Ms. Bisma, do you want to talk a little bit about the governance, or how was the management of the care coordinators?
Yes, please. Just I would like to add one thing regarding our participation. And maybe in the beginning I wasn't so clear regarding how nurses were participated. Unfortunately, the whole journey was owned by one department, so nurses were totally away from the participation. So that's why, which is more before 2019, but during that exact time, 2019, when we received the invitation from the National Transformation Office, that was the time they requested nurses to join and to fill the gap. So that's why maybe I came up with the last recommendation that nurses are supposed to be early participating in the journey, the whole journey. And still, as a nurses, we are not involved in the whole pathway designing. We just took that little part from the whole journey. So that's why I'm still demanding nurses should be participating ahead of time. I mean, from the beginning of the journey.
Dr. Neil, do you have any questions?
Just a couple, and thank you for that presentation. And it sounds like you've established a good process and an impressive education program. Do you think care coordinators can only be nurses?
For me, no, I don't think. I'm afraid it can be performed by any healthcare practitioners if they are having the minimum criteria, which I was mentioned during the presentation. And that's actually worked here in Jeddah. So not all of them are nurses. No, we have from radiology department, we have from the pharmacology department, all were participated in one program, and they received the same and equal chance for the training. And they were capable to perform the care coordinator.
Excellent, thank you.
If anyone has any question for Dr. Ms. Basma, or we can move on to you, Dr. Neil.
Okay. Thank you for this opportunity to meet you all. I've been looking forward to this for a little while now, talking to colleagues about the development of nursing leadership within your reform program. And what I thought might be helpful is if I draw some comparisons between the changing nature of healthcare in the National Health Service in England and in the Kingdom. Some similarities and differences, far more similarities than differences actually, and some strongly held views about the contribution of nursing leadership, which are born out of many, many years working in senior leadership positions in health care institutions in the NHS. I think this concept of Nursing Connect is excellent, and I would urge you that whatever happens and whatever the temptations are to be distracted because of operational responsibilities, that you keep this kind of forum running during this time of fantastic opportunity for the KSA healthcare system, and I hope a fantastic opportunity for nursing leadership to be able to step up to the plate even more than I'm sure it has done already. I start from the position then that nursing leadership is indispensable. You cannot possibly imagine how to reform healthcare unless nursing leadership is at the forefront, sat at the table when all of these discussions are taking place. In the last presentation, I couldn't agree more about the sentiment that as you're devising new models of care, nursing leadership should be at the center of that rather than contributing to just a small part, but more of that later. A few words about my background. I've worked in healthcare as a senior leader for the whole of my career, principally in the National Health Service. I've worked nationally, I've worked regionally, and I've worked locally as a CEO of some university hospitals. I'm the chair of a cluster equivalent now in England. I do other things as well. We call our clusters integrated care systems, and there's the first similarity, which I'll talk about later. And I'm currently an advisor to Dr. Mohammed and some of the senior executives within Holdco, and I'm a board member for C2. So I was delighted to hear, as people were introducing themselves, there's a C2 representative involved in this event today. During my time in healthcare leadership management, I've witnessed many major changes, national reorganizations, the like of which you're currently working through within KSA. And I've always been struck by the importance of the role of nursing leadership. And in the system with which I am familiar, that is the English National Health Service, nurse leaders are represented formally, legally in some respects, nationally, Chief Nursing Officer for England, within trust boards. There are chief nurses required there, and payer boards have chief nurses as well. In other words, there is a culture of having nurses in key positions throughout the whole of the structure of the National Health Service, but it's not just a question of being there, it's a question of what people do. So something about the context for change, and this is very similar to that which you are working through in KSA. Population growth and demographic change, the explosion of lifestyle-related long-term conditions. Our ability, certainly in the National Health Service, I'd be surprised if it's greatly different in KSA, of keeping up to date with technology, being able to invest in new digital solutions, pharma, medical equipment, etc. The maintenance of patient safety and quality, for which there is a laser-like focus in the National Health Service in England these days, following some very well-publicised scandals where large numbers of patients in some hospitals have died unnecessarily. You can add to that context serious issues relating to the workforce. I don't think there is a healthcare system in the industrialised world which will ever be able to train enough doctors and nurses for its needs. And that suggests, does it not, that we need to find different solutions, and serious financial issues for healthcare systems worldwide. In the National Health Service, we have our own pressures. You have the difficulty with your economy having to change because of the change in the use of oil and the reduction in oil prices. And there is a huge public, professional and political expectation about what our health services should provide. And then, of course, there's the pandemic. I'm sure you have discovered new ways of working to respond to the COVID-19 pandemic, things which you had always wanted to do, but which have seemed very difficult. Certainly the case in England, we have suddenly found solutions by close, intimate team working that we had not been able to find before. And your response to the context is set out within Vision 2030 and the Healthcare Transformation Plan. And in England, we have the same long-term plan which describes the problem and the solution. So let's have a look at the next slide, please, and think about the response. The response in both countries is that the current model isn't fit for purpose. And it's not fit for purpose for a number of reasons. It's very hospital-based. As nurses, you will know as you look into your wards and visit your departments, the large numbers of people who you see there who need not actually be in hospital very often, but are there because we've not done enough to prevent their ill health, and we've not done enough in primary care to stop their admission. And when they're in hospital, we can't get people moved out of hospital quickly enough because there isn't sufficient aftercare. So the model isn't fit for purpose. Being in hospital, we know, is not good for people. It's medically dominated and it's unaffordable. Thinking about the future, it is unaffordable. So something needs to be done. I think the biggest change in healthcare isn't actually healthcare. It's a renewed focus on the determinants for improving health and tackling the problems of health inequalities. We've known what they are for years, for a long, long time. We know what the ill health issues are very often, but we're not very good at focusing into communities and being specific about where our interventions might actually be able to make a difference. So in England, and I know in KSA, there is a renewed effort to think about population health management, the needs of local populations, and investment in preventive strategies, smoking, cessation, cleaner air, vaccination and immunization, dietary habits, and also things which are not the responsibility of health, but which need to be tackled if we're to fulfill our objective: improved education, housing, employment, and wealth creation. Now, in England, there is more and more happening in those other areas than has happened before, but we still have a long way to go. But there is a real focus now on population health management, understanding the determinants of health, etc. So if that's part of the response, then for you, it seems to me, the cornerstone is the new models of care. And we've heard something about that previously. So new models of care, frailty, diabetes, respiratory, CHD, etc., all need to be taken forward in a way which puts patients' needs at the heart of the development of the new pathway, and uses hospitals as a place of last resort. I don't know whether that's the philosophy in Saudi Arabia, but I sense it probably is. It certainly is increasingly the philosophy in England. And linked to that, part of the response is how to integrate organizations. You are developing clusters, and I commend you for that. And I also commend the approach to clusters with the integration of primary health care. We are developing something called integrated care systems, as I said earlier. They are very, very similar to the KSA model of clusters. But, and I think this is a very important point, if we stop our reform at the level of a cluster, then we'll have missed the point. We have to be able to provide improved health and improved care within localities, within smaller groups of population rather than just for the ICS as a whole. And the notion of integrated care teams managing patients' care out of hospital with multidisciplinary people, nurses, physiotherapists, GPs, pharmacists, etc., working in the same place with the same care record, sharing technology, has to be the way forward to be able to deliver the kind of response that is necessary. Alongside that, there needs to be an absolutely unrelenting grip on improving safety and quality. You will know that more than many, and nurses have a particular part to play in reminding us all about that issue. And we have to get this reorganization. We're going through another one in England just as we speak. We have to get through reorganizations quickly. Uncertainty creates inertia. Uncertainty means that good people often step aside. Uncertainty means that we aren't able to deliver the care that people require and want from us. So implementing new organizations quickly is imperative, even if it's imperfect, even if there are lots of loose ends that need to be tied. We can move on to the next slide, please. So just a few thoughts about contribution of nursing leadership. I bow to superior knowledge, an impressive array of academic qualifications shared by the attendees on this call, and I'm sure if I had your biographies in front of me, lots of practical experience in nursing as well. But I say again, in my opinion, nursing leadership is an indispensable component of multi-professional clinical leadership. I would not accept in my system a view that nursing might join into the development of a care pathway for just a small slice of it. I would want to make sure that nursing sat at the table with other disciplines from the start, looking at the whole of the pathway. I think nursing has a major responsibility, a moral responsibility almost, to sit at the board table and influence others about improving the quality of care and safety. I think nursing sometimes doesn't always feel sufficiently confident to be able to assert responsibility. That's a bold statement to make, but once nursing leadership feels this confidence and is able to assert itself, the good ideas that come from nursing and nurse leaders are many, and new ideas for safety and quality improvements. There are many of them that will come from nursing opinions. And the other area I would just highlight for the purpose of this discussion is leading aspects of new models of care work, which we've talked about, not just a slice, but the whole pathway, actually, in some cases. And how about nursing thinking even more about new workforce solutions? You will know when you look at the way in which clinical work is delivered to patients, there are many aspects of different professional responsibilities that need not be undertaken by highly qualified, highly trained individuals. If we take primary care in England, for example, general practitioners reckon that about 50% of their work need not be done by qualified doctors. They can be done by other people. And I use that just as a simple example. It's a bit trite, but you will know of many other examples as well, which you will have come across. I'm not going to lecture you about the leadership styles for nursing leadership, transformational, democratic, laissez-faire, autocratic servant. You will know about those. You can read about those for yourself. But my question to you is, what do you want to be able to do? If you had your way, and if you think about the development of clusters and the national reform programme in KSA for healthcare, what does nursing want to do? More of it currently already does, or what things might it want to do that it's not had the opportunity to do so far? That's my challenge, that's my question. I'm going to pause there. I think we've got a few minutes for questions and discussion, and I'll very gladly hand over to you. I think you're part of a fantastic radical change program, a change program which, as you will probably know, is being praised internationally, certainly in England, and I just think you've got a huge part to play in it, and without your very close involvement, it will not be as good as it otherwise could be. Thank you.
Thank you, Sir Neil, for this great presentation. Please, anyone if has a question for Sir Neil, go ahead.
Hayat, while they are thinking about what they want to ask.
Yes,
I
please,
just want to
Dr.
quickly,
Jessica. Yes.
quickly summarize and thanks Neil for a wonderful presentation in terms of contrasting what's happening in the UK versus the Kingdom of Saudi Arabia. What I want to share also is having been a young nurse who worked in the 80s in Saudi Arabia, and seeing the growth and changes that have come about have been terrific and amazing. Having worked in the Western countries and going back to Saudi Arabia and later in my career, I was just amazed and blown away with how nurses have stepped up, gone to school, graduated, taking leadership positions, stepping up. Some of the points that Sunil touched on with population growth and demographic changes, you can actually see them in action. And I think that's how Vision 2030 came about. But now it's also great to see, and having been part of the journey with the E1 cluster, seeing the changes that are happening to remove the care from the hospitals back to the PHCs and the communities, taking simple things like immunization to the malls and schools. Population health management has been the focus there. Having lived through the pandemic, also in the first early part of the pandemic in Saudi Arabia, I was amazed with how nurse leaders just stepped up, came together. Like Sunil said, you have to work together in teams, and that was one of the things that they saw in the NHS. We had nurses coming across the country to help us when we had some shutdowns in Qatif, and we're trying to figure out how to take care of our nurses, because almost 60 to 70% of our nurses came from that area. But it was amazing to see how nurses were squeezing themselves and trying to be more innovative, trying to figure out how to safely care for their patients in the light of all the nuances with coronavirus changing rapidly, infection control protocols and so forth. So want to report off and say, Saudi Arabia is to watch out, because they're doing really well with nursing. The difficulty that we are really having is having nurses at the table early. In the Eastern province, it's a lot more established. I'm not sure about the rest of the clusters, but I know there's a lot more awareness, and we need to push that to make sure that even from the cluster point of view in health holding, that they realize that nurses have to be part of this conversation early, and to be able to take it to their nurses through all the leadership levels, right up to the frontline staff. So thanks, Neil. And I think that summarizes what Saudi Arabia is doing. I'm just impressed with how fast they're moving and closing up the gaps.
Me too. I'm very impressed indeed. It really is a stimulating pleasure to be working with the Saudi system and with people like you guys. It's excellent.
Right. Wonderful. Thank you.
Thank you, Dr. Jessica. We have Ilham.
Yeah. Thank you very much, Dr. Neil, for the presentation. And thanks, Jessica, for your comments. It's nice to hear your voice again. Reflecting on, also I'm being a consultant in the E1, and looking at how far we came from transformation when it started in E1 in terms of nursing. Actually, two components is very crucial, in investing in the future for transformational, and that's what we tried to achieve in Mecca. Two factors were very important for us to move fast and within the line of transformational is one, having the chief of nursing directly on the lines under the CEO of the cluster or the system. The other thing, being on the highest strategic level is a key point for the progress of the transformation, like any other professional. And with the tried and the bide model, having medicine and nursing riding this is the true transformational that we can integrate it, and it have to be reflected in our structure. The other thing that really helped a component investing like Mecca case, we have 10 hospitals and 10 local Saudi leaders. Of course, the challenges and building capacity for leadership is one of the hugest challenges that face us. But honestly, from the implementation and the way we have addressed it, given the situation of a powerful representation of nursing in the structure, it made a huge difference. Actually, nurses on the ground is riding the transformational with evidences, with implementing of the strategy. And this is a case that it will be built for all, inshallah, structures that we really, if we invest in nursing and we brought the frontliners and really put the, they need the tools. We need to give them the tools to tell them how to invest in them, and it will amaze you, especially in nursing, how the outcomes are. And with this humble experience, being in more than one area with nursing, I cannot agree less with also Jessica. We are very proud, honestly. And honestly, nurses, they are walking the talk and they are making difference. And I'm sure, transformational, it's gonna bring nursing in Saudi Arabia to a very, different level, because that's the opportunity that nurses in Saudi has been waiting for. So thank you so much. I really enjoyed this conversation, and I look forward to hear from you more, inshallah. Thank you so much.
Thank you. Can I ask a question?
Sure.
How many presidents of clusters or chief executives of hospitals are from a nursing background?
Actually, none. And
none.
To be honest, no, none. As CEO in a hospital, still we are not there, but the concept is out. I think, it is changing. Still, it is changing. But as a CEO, being a nurse, it's not yet. But alhamdulillah, a lot of cluster is replacing nursing in the highest, hierarchy, within the structure with equal power. And, it is really happening in Saudi. So that's, alhamdulillah, that's a big change for nursing in Saudi.
That's good. That's good. There are many chief executives of large hospitals in England who come from a nursing background. I spent some time with one yesterday, one of the biggest university trusts, hospital groups in the country, who I worked with previously when she was a nurse before she became a chief executive. And there's a richness of experience, in my view, that nurses can bring to those kind of jobs. But it'll take time. It'll take time. But I hope it's an ambition that's fulfilled in the not too distant future for you.
Actually, it's really that's what I am anticipating. But, I'm very optimistic that, when Saudi nurses will come together and we have that kind of continuity, it's making a huge difference. It is, they are, as I said, we have to invest in them, just give them the tool. And our experience has been very rewarding. That's really, will showcase that if we put the right resources, the right investment, we'll get, inshallah, very quick result and very effective, inshallah.
I would be very happy if this Nursing Connect group was interested in asking one or two of my friends and colleagues who are chief executives in England and also nurses to come and talk to you about their experiences. But I'll leave that to you. If you're interested in that, I would very easily be able to talk for you.
Thank you so much. I'm very interested, but it's more interesting to put it on more an audience. And I think the real audience we should target is our colleague and our other healthcare professional, so we can really move the way that's the way of thinking.
That's a good point. That's a good point. Take that point. Yeah.
So hi, it's Abdullah from the E1 cluster, and thank you for your presentation. It was really excellent. I want, which hospital in the UK did you work in?
I was the chief executive of the Leeds Teaching Hospitals.
Leeds Teaching Hospitals.
And I had senior positions. I was chief executive of the Sheffield Teaching Hospitals, and I worked as a middle junior manager at St George's Hospital in London. But I've worked in lots of other hospitals as well. I've had responsibility for running mental health services, services for people with learning disabilities, community services. And there isn't much that I've not been involved with over the years.
Yeah, that's good. I really like Dr. Ilham. Thank you for what she said. We'll really be interested in getting one of the CEO with nursing background from UK to learn from what they've gone through and to put us through some things as well. Thank you.
You're welcome.
Sir Neil, we definitely will pick you up on that offer. I wanted to hear from maybe C1 and C2, Dr. Fahima, and C1 Dr. Abdullah. We're really keen to hear about your experience, especially that you're one of the established clusters. If you have any reflections to share. Okay. In that regards, I don't know, there's someone on mute, iPhone Rehab. I don't know if you had something to share. No? Okay. So any more questions or reflections, feedback? Okay, feel free also. Dr. Fahima?
Yeah, I just want to thank you all for this very informative session. I just want to share with you that I've received the invitation as a coincidence, because this invitation has been sent to one of the middle of care lead who is a physician actually, or who is a consultant, MFM consultant, because I think they presume, just as Dr. Ilham is saying, nursing leadership in the cluster level, in the national wise, is not led by nursing actually for the time being. However, you know, by chance, I'm really glad that this chance or this coincidence happened today, because I'm so glad to be, you know, listening to all over the national nursing leaders. It's my first time actually to be coming across. Of course, our inspiring Dr. Ilham is the lead from the beginning, that always ensured that we are all talking to each other, and we are sharing our lessons learned, and sharing our success, our challenges, and what is coming up front, inshallah, which is very, very we're all optimistic, and we're all looking forward to our healthcare transformation in the kingdom. It's going fast. It's going very in according to the plan. However, I think our input or our we have to be at the level of decision making, at the level of stakeholder in which we really contribute. And from the one experience that has been shared from Jeddah, actually, it shows when the nurses put their hands on in this project, it become more. You know, it became more implemented. It was implemented. It was happening, and it was achieving its own outcomes, or the real outcomes that they were looking for. So I think in the future we need to really have a close network in which we have all our numbers or our shared email addresses. So at least we keep in touch, and we will go through this journey together, because we all in one country, and when we all looking forward with this ambitious vision that we are all looking forward to achieve, inshallah. Thank you very much.
Thank you.
Thank you so much, Dr. Fahima. I'm glad you were able to join us, and we'll definitely make sure that the list of contacts is updated to reflect any recent updates. I just wanted to also emphasize what Dr. Ilham mentioned around building the leadership capacity for nursing. And this is definitely one of the aims and the objectives we want to work on in the next few months, and offer different channels to build capability and you know, improve understanding around the transformation and its objectives. And finally, I wanted to add also that we will definitely be hosting more speakers that can give us insight around different nursing models. And I think Dr. Ilham, your point around including the model of care leads and the CMOs in these sessions, we have shared sessions between the CMOs and model of care leads. So I think having a shared one as well to include the nursing and highlighting some of these key recommendations will be important. Thank you so much, Serene.
Thank you.
And now we go on with Dr. Ilham. Yes, you can again, Dr. Ilham.
السلام عليكم ورحمة الله جميعا. بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد وعلى صحبه أجمعين. I'm really humbled and honored to share our ongoing work in Mecca cluster jointly with my colleague Dr. Samah, who is leading the MOC-led journey, the MOC-led in Mecca healthcare. In this slide, Dr. Samah will discuss the journey of the MOC, but let me first, brief you on what I'll be speaking about. This is a specific project. We started in June implementing. In March, actually, we wrote the milestones, and in June, we started implementation. Number one, we want to look at, having experience being with the model of care when it started in the E1, the lesson learned is that, and the challenge is how to bring the model of care to nurses on the ground, on the frontliners, and we started with Dr. Samah, who's very supportive of nursing participation. And that's what we have, looked at our initiatives, our projects, and how we can align nursing within what's happening in transformational. And I think this is a message for all of us from our learning experience being on the transformational, that, we have to be involved. Nurses really have to be partners on the model of care. They have to feel that they are partners in the model, because a lot of the implementation of the model of care would depend on their understanding and their involvement and their engagement. Number two, our initiatives that we strive, we need to be very aware of accountable care organization, be with the MOC, and as well, understand the service-led and the transformational to be able to contribute equally on the table with the transformational of healthcare in Saudi Arabia. We're a firm believer for transformational to take care all the biggest workforce in healthcare are physicians and nurses, and this is what we are in Mecca, the vision we are going to achieve. Dr. Samah?
Yeah.
Dr. Samah? Yeah.
Good afternoon.
Dr. Samah will just make an introduction for Mecca healthcare MOC. Later, I will just talk about how we integrated, just an example about the professional practice model on a cluster level and how we did integration with the model of care.
Thank you so much, Dr. Ilham, and good afternoon, everyone. I can say this is one of the proud moments that I'm happy to be part of it, because just to introduce myself, I'm a physician who's a big believer in nurses. Then I'm a pediatrician and pediatric emergency physician who have been witness how much nurses can make a difference and how much we need their voice to be on the ground. Then I'm a model of care director who is very proud and happy to work with the team of nurses that ambitious and really believer in the transformation and how much we need to move forward together as a one unit. To start with, I have been the model of care director since January 2020. And I remember the first time the outline that I put whenever there is a committee or team going to work with the model of care, we have to have a nurse representative because we need to cascade down this voice, and we need to build up leaders who are working hands to hand with a physician, drawing every single step and involved in every single improvement project. And thank you so much for Dr. Ilham and the leadership in the cluster to make this not on as a plan on the real. And Dr. Ilham going to explain more how we did it. So with the concept of the triad module. So we have today a 10 working group or a 10 system of care. And mandatory when they select their team, we have to have a nurse from the primary healthcare that will be the future leader, and we're going to invest on her or on him to lead the transformation with us, and another nurse from the hospital. Their background matching the system of care. For example, Keepwell, we have a nurse representative from the community with a community master degree. And we have another nurse who's working in the school health. So she is aware how we're going to bring the Keepwell concept to the ground. And this is similar to the safe birth, urgent care, and etc. So today we have a 10 working group. Each working group that it's reflecting on the system of care working team with a nurse from the primary health care and a nurse from the hospital. And when I emphasize when we're going to release the letter that have been assigned from the CEO, we have to make the nurse on the top of the letter. To this extent, I'm a big believer in the nurses. So the consequence was the system of care leader, then the nurse. So just to give a hidden message that we need a nurse and nothing going to happen without a nurses. And this is really very, very, very impressive journey, and really there is a lot of learning lesson that all what we need just to empower people, and we need to raise their voice or give them the chance, the podium or the chance to show us how much they are capable. Yeah, it's just a very amazing journey, and Dr. Ilham, I'm sure she's going to talk more about it. And every day that we are adjusting this blend and bring more nurses to the ground. So no model of care, no pathway without a nurse opinion and without a nurse input. This is in brief.
Thank you so much, Dr. Samah. Looking at the time, I'll start my presentation talking about the professional practice model. Actually, professional practice model is one of the initiatives that we have. Our initiative is called Achieving Nursing Excellence. And as you all know, that, alhamdulillah, we have in Saudi Arabia 3 magnet hospitals, one in Riyadh and one in Jeddah and King Faisal, and lately, mashallah, in King Fahd Specialist in Dammam. And all of them, they have the nursing professional practice model in place. But what we do in order to move further in transformational, we are thinking, this is the creative exercise that we've been going through with the nurses here in Mecca, how to create a professional practice model that is aligned with the MOC, at the same time with the ACO, with the accountable and the vision for the transformational. And, I just want to present to you our humble experience and ongoing work with aligning the nursing professional and moving the nursing profession in Mecca cluster towards being engaged in the model of care through a lot of strategy. And this nursing professional practice model is one of them. So as you know all, I wouldn't go in detail, as just briefly, as you know all, The nursing professional practice model is a system that have structure, process, and outcome that support registered nurses and support registered nurses over the nursing care deliveries. And also it aligns the nursing practice with the vision and the philosophy. And this is very important to bring all nurses aligned with their vision, with their different strategic plans before, to bring them aligned with the vision of the transformational and the vision within the values and the vision of the model of care and ACO. This is also, it will provide a framework for interdisciplinary patient care, and it will guide nurses to their decision to practice, how to practice, communicate, collaborate, and develop. Of course, also it promotes safety and optimal patient outcomes. The professional practice model, for the component of it in Mecca, we have the standard of nursing practice, the standard of the professional performance, the care delivery models in nursing, the shared governance, mission, vision, and values, and last, the patient, family, and community and health care team. One of the challenges that faced us in developing the model is not having a national standard of nursing practice. And I think through the clusters, and it is like more a regional, having standard of nursing practice, I think it will accelerate having the national the national standards of nursing practice, because still we don't have we do have Association of Nursing, alhamdulillah, up running. Inshallah, we're optimistic that we're going to have a national one. But this was built, developed locally, and with consultants from academy, from the service, from the Western region, that they came together and we put the standards of nursing practice. Also the standards for the professional performance. The component of the PPM is one of them also is the care delivery, where where nurses' authority and accountability for clinical decisions and outcomes is clear, depending on what is the care delivery models that's been deployed. The shared governance, and this is the number one exercise we made. We implemented this component for shared governance, and we have a long way to go. We created unit-based councils. We created on the cluster level certain councils. For example, the Professional Practice Model Council, Research and Evidence-Based Council, and the Clinical Practice Council. And through those councils, we are really, we kind of like implemented part of the shared governance for the model. Our mission and vision and value, they are all embedded and aligned with the vision and the values for the accountable healthcare. The journey of developing the PPM, I will share with you some of the, there's been a 6-month or more journey. We made a lot of awareness workshop about, even the concept of having a professional practice model for nursing. And we developed first the standard of nursing practice, and we got a lot of input from key nursing consultants. We formulated the theoretical framework. We had long discussions, long meetings with, and all nursing directors in Mecca cluster were involved. And even their frontliners with head nurses and leaders, they were part of the development of the professional practice model. And then we sat with the MOC, we did the alignment, and with the AOC, that is like the playbook that is given by the transformational. We designed the PPM, we did a lot of piloting, and I will show you also, different design until we started into piloting and launching the professional practice model. We employed 5 theories to explain our work. Those are, the theory are globalization theory, and the cultural diversity theory that really applies, especially with the background of Mecca and pilgrims. If you can move the next slide, my dear. So global theory and diversity theory really works very well for the model and for the Mecca region. Next. And also, the caring, we employed caring theory and the holistic approach, which really is Newman, that focuses on primary, secondary, and tertiary prevention. Next slide, my dear. This is, can you move? Yeah. And also, lastly, we employed also the transformational leadership theory. And actually, that was a heavy exercise. Next, the heavy exercise with nurses really bringing them to understand all those concepts. It was in the beginning a lot of learning. We gave them tool articles. We shared a lot of sessions. We do huddles. Through the huddles, we keep discussing and presenting the concept. And by the end of the 6th month, with their annual reports for each hospital nursing director, this was really reflective on the output, this whole work and the language. We noticed that their language really changed, especially in the Ministry of Health hospital. Now they're talking about empirical outcome, exemplary practice, transformational leadership. So we are measuring the impact of this whole through gap analysis that we conducted in the beginning of the transformational. Next. Yeah, this is just to illustrate for you the phases. We developed a lot of version until the last one is the version that is least we agreed on. And this exercise was with all the directors and the nursing in the front line. Next, yeah. This is the model. This is the model, the proposed model. As you see, Mecca and the global, it represents Mecca health, professional practice model, because Mecca, as you know, it's a place for pilgrims and a lot of globally global what do we say? Global Muslims come from all over the world. So the center is surrounded by dots, and those dots are the stakeholders, staff, patient, and family and community. And those arrows are the pillars, our pillars. Shared governance, cultural diversity, standard of practice, and standard of performance, resource management, and care delivery model. And we have the cycle arrow represent the attached healthy work environment as a result of the implementation of the pillars. And finally, the external symbol reveals the outcomes. Cost effectiveness that is consistent with the outcomes of and aligned with the ACO and MOC, patient satisfaction, staff satisfaction, and quality of care. ACO, as you know, this is just like a slide. ACO, it's very important. We kept in mind, the care delivery system, the quality of care, and the cost of care, since this is the definitions and aim to improve people experience of care, improve population health, and reduce overall cost. So this is the alignment. Next, my dear. Next. Yeah. As you see up above the model of care, and this is the conceptual alignment of nursing professional practice model. So if you see here, we have how we aligned our model with the ACO, the Accountable Care Organization, through all the tasks that nurses do under population health management, care delivery, and financial management. You know, for example, by improving the staff satisfaction, by improving the retention of nurses, that we have action plans to improve it. You know, we reduce the cost, minimize the absenteeism, and this is really, and one of the things that we have been working on also, looking at the time that nurses is doing other tasks that's non-nursing, and really focusing on utilizing nurses' time in direct care. And that has been one of the biggest issues that would really, in the future, reduce a lot of the cost and utilize the nurses' workforce in Saudi Arabia in a more efficient, effective way. And another thing we have implemented, one unique program. It's not a program, a framework, and it is targeted to really address the overlaps in the career development for nurses. And it is called Nursing Career Continuum, and it is based actually on the conceptual framework for the ICN. This continuum, it's really help us to reduce the costs and to make more effective professional development. At the same time, the roadmaps for nurses who enter any of the cluster in Mecca would know exactly what's the expectation they go, whether it's onboarding, orientation and competencies, residency program, training through for the MOC, and also succession planning, where we also made a lot of building capacity for the future leader, and already the succession planning and mentoring is ongoing for 10 leaders on the ground. This is how we started in the next. This is the alignment and the exercise. Of course, as you see above, structure, process, outcome. And we looked at the model of care, ACO. We looked at all what we have now in Saudi and try to align the model of care with the process. Next, this is to illustrate the exercise of alignment. And as you see, you know, it really aligns with the concept that MOC is about. Next, this is the process. And this is how we align the process with the MOC. And next. Next. Yeah. Before that, you know, this whole will lead to the 5 principle that's gonna be, it's based on the MOC, which is empowering people and their families to have control on their health, providing knowledge to people as part of their treatment, people perspective about the integrated health system, a preventive approach, more than a curative approach, and providing treatment in a patient-friendly and outcome-focused way. So some of those strategies of engagement, as Dr. Samah has mentioned in the beginning, you know, we created, me and Dr. Samah, the representative and the model. Next, please. Just like a process to guide us of how we get the nurses more engaged and feel empowered to participate in the model of care. And that's very crucial, you know, getting them interesting on the table and making them feel they are part of the model of care, you know, was one of the things that we had to really address at the beginning with Dr. Samah and her team. So we made a lot of meetings together, where first we started our awareness on the level of the cluster between us as a team, and then we started doing the awareness with the leadership through huddles, and it went down and sharing all the resources through WhatsApp group, and then we started looking at, you know, the communication process that can make us, you know, increase the engagement and empower them and follow up with their and support them at the same time with their representation in the MOC from the nursing perspective. Next, the focus areas of all our work, we look at standardizing, scope of practice, the organizational structure, the policies, the competencies and training, and, to lead us to patient satisfaction, staff satisfaction, and to best utilize the resources for a quality of care and quality of work. Next. These are some of the meetings on the level of the cluster where the team of Dr. Samah and the team of the nursing come together, brainstorm, and share milestones, share progress, share challenges, and we have those meetings regularly. Next, awareness to the pathways nursing representative. We created a group for them, and we really drilled down and focused and looked at, for example, one of the challenges faced, having them free to do the work and to really maximize their engagement. So we look at, all of those to better really, for the best engagement of the nurses in the MOC. So, this is our humble experience, and it's ongoing. And we are very open for your questions, for your comments, for your remarks, suggestions, and thank you so much for the time.
Thank you, Dr. Ilham, for this great presentation, and Dr. Samah. Anyone have a question for Dr. Ilham? Please go ahead.
On what was said, I think what the effort you, Dr. Ilham and Dr. Samah, have taken part in is commendable. You really showcased great collaboration and alignment, and I really specifically enjoyed the alignment between the model you presented and the ACO capabilities and manual, and I think this will be very useful for other clusters to kind of learn your lessons and what your experience has been from. Thank you so much. Dr. Jessica, I believe you wanted to share some reflection. Dr. Jessica?
Oh, hello.
Yes.
Yeah, thank you, Dr. Ilham. That was very extensive and great philosophy for Mecca. Like Noura said, I think it was great that you showed the alignment for the model of care with the professional practice model. And obviously, you've been very busy doing a lot of things, putting this together. I love that the nurses from the front line to your highest leadership have been engaged in supporting and understanding this very complex model. Good luck to you, and hopefully we can have something similar nationally.
Thank you, Jessica. Thank you.
Okay. Any more questions or feedback? Well, feel free to speak in English or.
If you allow me, the experience during the previous period was really amazing, and just I learned a lot about the nurses, and I hope that all the physicians, all the medical representative across the national and the cluster to understand how much we have a treasure within the nurses and how much we need to bring them to the table and listen to their voice. So I suggest that at a national level, just we need this kind of connection between the medical and all the subspecialty with the presence of the nurses, so we can do it together because at the end of the day, it's a patient journey, regardless who serves the patient or who provide the services. Nurses have a very critical role in all the pathways, the journey, as well as the physician, the other healthcare providers and the administrative providers. But just we need to bring this momentum that nurses and physicians together to drive the transformation.
Thank you, Dr. Samah. Completely agree. We have an upcoming Connect session for CMO and model of care leads, as you know, on the 22nd. So if you and Dr. Ilham wouldn't mind, maybe that would be a good opportunity to showcase the alignment and showcase double one's efforts in bringing the model of care and the nursing models close to each other and your plans. Is that something you would be willing to do again and تعبكم شوية?
Atir, I'm very happy to share again our experience with the MOC, and actually you raised a very important part. How do we move further? I think at this stage, having a nursing connect is a great thing, because we need at the beginning to share on the level of nursing directors and to get connected, because there's a lot of support that is needed there and a lot of sharing that is needed to be there. So the next, I think, in the future, maybe we should look at having one group that really join together in one group, a connect MOC, physician and nurses connect, where we can hear from them at the same time they hear from us on the same table. But I don't think nursing now is ready. But I think something to consider in the nearest future, inshallah.
Excellent. That's a great idea. I think that's a key action. We will come out of this meeting, and I think we want to try to also bring recommendations from these Connect sessions and share them with the CMO Connect session as well as the CEO Connect session, so they can bring up these discussions in the cluster. If no one has anything else to add, I just wanted to reiterate some of the recommendations that came from the session. أولاً, to involve the nursing at the C-suite level in clusters, so to have them involved in strategic kind of organization structure clusters. The need to build the capacity of nursing and leadership in order to fulfill some of these roles. Empowering the frontliners with the tools and methods to lead on the transformation and initiatives. Look at different, models. Sir Neil mentioned around CEOs with the nursing background and the benefit that the individuals bring to the organizations they lead. And ways in which the nursing can partner with the model of care, such as in what you mentioned, Dr. Ilham, bringing in a joint group to have some of these discussions and look at the ways of working moving forward. I think this will definitely be applicable, especially that the ACO manual, which we're now at the household holding company level are revising, has a care delivery chapter that would require the engagement and collaboration of all teams and parties and multidisciplinary. So that's all from my end, our end. Thank you, Atiyah. Thank you, Hayat. Thank you for everyone. Thank you, Dr. Jessica. Thank you, Sir Neil, Dr. Ilham, Dr. Samah, Ms. Basma. Thank you so much for sharing your valuable experience. We encourage whoever attended today, if in our next session, which inshallah will be if maybe next quarter, we'll decide on the frequency. If you have an experience that you would like to share, please reach out to us. We have a WhatsApp group that also we will have these discussions in. So thank you so much. يعطيكم ألف عافية. Thank you for your time.
Great, thank you so much for this opportunity. Thank you everyone for listening and your patience.
Thank you everyone. Thank you.
Yeah.
Thank you all.